This infant was born vaginally 1 minute ago. The baby's mouth was suctioned first, and then the nares were suctioned immediately. The baby was dried off, and the cord was clamped. So the baby was placed on mom's chest, and the first signs I see of the baby after the baby is born would be their skin color. And for this baby, they turned palish pink. They have no mottling, no noticeable jaundice, some mild acrocyanosis on the hands and feet, which is normal. The baby was crying, and they're alert. The movement was present, and the baby's now, like I said, on the chest and is doing skin to skin. So the baby is calm now because he's with mom. So while the mom is holding the baby, I'm going to listen to his heart rate by palpating or auscultating. I will auscultate if the baby is crying, but since this baby is calm, I'll just listen with my stethoscope. So when I am listening to the baby's heart rate, I'm going to tap. So I will tap while I'm listening for a full minute, and the tapping is so that another nurse can help me count the baby's heart rate, because the baby's heart rate is really fast. So I'll do that for a full minute. And I noticed the mom kind of repositioned the baby, and the baby grimaced a little. So I would give the baby a 1 minute APGAR score of an 8. And I will do this again in 5 minutes, at the 5 minute mark, and reassess that. So mom and baby will have at least 1 to 2 hours of skin to skin after delivery, so that they can get that bonding. And in this time, I'm going to assess the baby's feeding. So I noticed that the baby's rooting for mom. So there is that rooting reflex, and you can help, yes. And so then I'm going to place a glove on, because I'll want to assist mom if this is her first baby or her fifth baby. All babies are different, right, Lenny? She's fine. So I'm going to place my gloves on, and I'm going to help with the baby. At this time, I'm going to place my finger into the baby's mouth, and I'm just going to make sure that they have a hard palate and a soft palate intact. And at this time, I can also note that the baby does have a suckling reflex because he's sucking on my finger, and I'll check the tongue to make sure it's movable and there's no ankylosing or swelling. Thank you, so I can see better. The baby, so after that, I'll just, kind of guide the baby to mom's breast, and so the baby looks like, it appears the baby is swallowing. Both nares are patent because the baby is able to breathe. There's no distress. And at this time, I will give mom some time before doing a full head-to-toe assessment. So once the feeding is done and mom's had some time with baby, I'll let mom know that I'm going to weigh and measure the baby. So, mom, since everything... Thank you. Mom, since the baby has calmed down a little bit, I can get the baby's first weight and measurements and check them out. Do you mind if I take the baby? So now I'm going to take the baby from mom. And I'm going to take the baby over to the layer. So this time I have the baby, and the baby is naked. And I'm going to place a chuck on the scale, and I'm going to zero out the scale, and then I'm going to just place the baby on the scale. And it looks like the baby weighs about 7 pounds, 14 ounces. So then after that, I'm going to take the baby to the warmer. Okay, so the baby is now in the warmer. Okay, so the baby is now in the warmer, and this is where I'll place his bands on his ankles, and I'll also take the baby's temperature. So I'm going to take that by putting the temperature in his armpit. So the temperature looks like it's 98.6 axillary, so that's within normal limits. Then I'm going to measure the baby's head. So had just right at the occiput, and just right above the ears. And I noticed that with this baby, it's about 35 centimeters. And then I will also take his weight, or measure his length. So for his length, I'm going to take a pin and I'm going to mark a little place above his head, and then I'm going to stretch him out and then mark the bottom of his feet. And then that way I can just take the tape measure and place it from pin line to pin line. And I noticed that the baby is 19.5 inches long. So these measurements are all within normal limits, and I'll also measure the chest, around the chest, and I'll be quiet. These measurements are all within, yes, I measured the chest, and then at this time, I'm noticing the baby's head shape. The head shape is round, and then I'll palpate the front nails. The anterior front nail should feel about like a diamond shape, and is about 3 to 4 inches long, and about 3 to 4 centimeters long by 1 to 3 centimeters wide. And the posterior smaller fontanelle is about 1 to 2 centimeters wide. And the sutures, they're all present and palpable. They're slightly open, and I don't see any swelling or bruising. I'm checking the skin just to make sure everything is intact and smooth around the head. The ears are in their typical position. The top of the ear aligns with the eyes. There's no abnormalities with the ears or the cartilage or the pinnuts, are all firm. And overall symmetry in the face. So the facial structures are all pretty symmetrical, crying or calm as the baby is now. So when the eyes are open, I will check the red reflex with my pen line, and they should be present and symmetrical, and eyes should be curl up. The inner canthus to the inner canthus should be about 2 to 3 centimeters. So again, curl up. Pupils are round, equal, and reactive to light. The iris is darker light, and the sclera is like a bluish white with no yellow, so there's no jaundice noted. The cornea and the lens are clear and intact, and the conjunctiva is pink and moist with no discharge. So at this time, I would probably apply the erythromycin on the eyes by taking my fingers and opening the eyes, and then just doing one ribbon across the eyes, making sure not to touch the eyes with the tube. So just going down, I'm going to check the neck. There's no webbing in the neck. The collarbones are smooth, and there's no crepitus. The shoulders, I'm going to check, kind of just do a little range of motion check, and everything's good there. The chest is rising symmetrically. It's a cylinder shape, and the sternum is flat with no depressions. So then I'm going to listen to the heart, and I will listen to the heart in the 8th command. You're going to listen to your baby's heart? So I'm going to listen to the baby's heart in the 8th command format, and again, I'll tap, and I'll listen for a minute, and S1 and S2 are present, and S2 is slightly sharper and more high-pitched than S1. The PMI is at the lower left sternal border, and that's where I'll be able to hear that. I don't hear any murmurs, but some babies do have murmurs that will disappear within a few days. Then I'm going to listen to the lungs, and I'm going to listen to the lungs on the front in a V method, and I'm also going to turn the baby over very gently by holding the bottom of the jaw, and I'm going to listen to his back. And what I'm listening for is to make sure that the lungs are equally loud with no adventitious sounds. I'll listen for a full minute, and then I'll notice the respirations, and this baby, we'll say they're 35. I will check the back while I'm back here, and I will notice that the spine is in, midline, and there's no spots or discolorations. There's no sacral dimple. The buttocks are symmetrical. I said the spine is straight midline. So then I'm going to flip the baby back over, and then I'm going to just kind of go down, and then I'm going to check the belly area. So I'm going to check the umbilical cord, assessing and palpating. I don't feel any hernias. There's no distension. The belly is slightly protruding, which is normal, but it is soft, and the liver is not palpable. So I'm going to listen to the bowel sounds in all 4 quadrants, just like I normally would. And the bowel sounds are present in all quads. So the umbilical is clamped. There's no bleeding or any drainage or odor. There is 2 arteries in one vein, and it's a whitish gray color, which is normal. So then I'm going to go down to check the groin pulses. So I'll do 1 groin pulse and then the other, not pushing too hard. And they will be steady and equally bilateral. So I'm also assessing for inguinal hernias at this time, and then we'll go to the genitals. So in this case, this baby's a girl, and the genitalia is a little bit swollen, which is also normal. There's no discharge or bleeding. There is a labia majora. It meets it meets at the midline and the vagina, and meatus are present. For male babies, I would assess the testicles by palpating with my finger and my thumb on each testicle to make sure that they are distended. And then I will also check the penis for colors and abnormalities. So then I would assess the patency of the anus by separating the gluteal cleft and making sure that is all right. So since I'm down here, I'm just going to assess the baby's hips. So I'm going to bring the hips up, and I'm going to adduct and abduct both the hips, pressing a little bit on the knees, and I don't feel any popping or abnormalities. So then I'm going to check the baby's fingers and toes. So I'm going to make sure that they have 10 fingers, 10 toes. I'm going to place my finger in the palm of their hand, and this baby grasps, so they have a grasp reflex. I'm going to check the nails, make sure the nails are present and intact. I see that the baby is in the flex position. He's all cold right now. And I'm going to lift the baby's arms up and see how the head lag is. It should briefly be held, and this baby has good traction. Holding in this position, the baby, I'm going to place my hand on the back of the head, and I'm kind of just going to not really jerk, but kind of make it so the baby seems like he's falling, and his arm should jump out and then come back in, and that shows that he has a good startle reflex. So after all this is completed and mom has some rest, I will put a diaper on the baby so I don't get peed on. Once I'm done with that, I'm going to place the diaper on, and then I'm going to swaddle the baby up in a good swaddling position because the baby's really, really cold. So I'm just going to swaddle. Yeah. And then the baby is good to take back to mom and probably have another feeding.